12 silent signs that occur before a stroke. Don't ignore them. Imagine waking up one morning feeling just a little off. Maybe your vision is slightly blurry, your hand feels weaker than usual, or your speech sounds a bit slurred. You brush it off, thinking it's nothing. But what if that's the first warning sign of a stroke? What if you only have minutes to act before it's too late? Every second matters. A stroke can strike out of nowhere, leaving people paralyzed, unable to speak, or even worse, dead. The biggest mistake? Ignoring the subtle warning signs. Today, we're uncovering the 12 silent symptoms that many people overlook, the symptoms that could mean a stroke is coming in the next hours or days. If you notice these, you must act fast. The silent signs you must recognize. Number 1. Sudden and severe headache. The brain's emergency alarm. A stroke isn't always painless. A sudden, excruciating headache, unlike anything you've felt before, could be a sign of a brain bleed. If you experience an intense headache that comes out of nowhere, especially if you don't normally get headaches, seek emergency help immediately. Number 2. Blurred or lost vision. Your eyes are trying to warn you. Have you ever experienced sudden blurry vision, double vision, or even temporary blindness in one eye? This is a red flag that something serious is happening in your brain. A stroke can affect the nerves connected to your vision, making this one of the earliest warning signs. Number 3. Sudden weakness or numbness, even in one finger. If you feel weakness, tingling, or numbness in your face, arm, or leg, especially on one side of the body, this could be your body's way of telling you a stroke is on the way. Many people ignore this, thinking they just slept wrong, but this is a huge mistake. Even if it lasts just a few seconds, call for help. Number 4. Confusion and trouble speaking. Words start to fail. Have you ever had a moment where your thoughts feel scrambled? Maybe you try to speak, but the words come out jumbled, or you suddenly can't understand what others are saying. This is a major stroke warning sign. The brain controls speech, and when a stroke begins, your ability to form words may suddenly become difficult or impossible. Number 5. Sudden dizziness or loss of balance. The brain is struggling. Imagine standing up and suddenly feeling like the entire room is spinning. If you feel lightheaded, dizzy, or have trouble walking, especially if it happens out of nowhere, this could be your body's way of telling you that a stroke is cutting off blood flow to your brain. Number 6. Jaw or facial drooping. The classic stroke test. One of the quickest ways to check for a stroke is by looking in the mirror. Does one side of your face seem lower than the other? Can you smile evenly? If not, this could mean your brain isn't sending signals properly. Number 7. Shortness of breath. Your heart is struggling too. Not all strokes start in the brain. Some strokes originate from blood clots in the heart, which can affect your breathing. If you feel out of breath for no reason, especially with chest pain, act fast. Number 8. Difficulty swallowing, a hidden warning sign. If swallowing suddenly becomes painful, difficult, or feels like something is stuck in your throat, this could be a sign of a stroke affecting the muscles in your throat. Do not ignore this. Number 9. Feeling extremely tired or disoriented. A sudden, overwhelming wave of fatigue that makes it hard to keep your eyes open or function normally could mean your brain isn't getting enough oxygen. If this happens without explanation, do not take a nap, get help. Number 10. Uncontrollable hiccups. A bizarre but serious sign. Believe it or not, persistent hiccups can be a warning sign of a stroke, especially in women. If your hiccups last longer than usual and come with chest pain or dizziness, call for emergency help. Number 11. Sudden mood swings or personality changes. Has someone close to you suddenly become irritable, withdrawn, or aggressive? Mood swings can happen when a stroke affects the part of the brain responsible for emotions. If a loved one is acting strangely, check for other stroke signs. Number 12. Seizures, a stroke's most dangerous clue. Seizures can sometimes be the first sign of a stroke, especially in younger adults. If someone has a seizure out of nowhere, especially if they've never had one before, get medical help immediately. What to do if you notice these signs? Act fast. The fast test can save lives. F. Face. Ask them to smile. Is one side drooping? A. Arms. Ask them to raise both arms. Is one weaker? S. Speech. Ask them to say a simple sentence. Is it slurred or jumbled? T. Time. If you notice any of these, call emergency services immediately. A stroke can kill within minutes. But if you catch it early, survival rates and recovery chances skyrocket. The hidden stroke triggers you must avoid. Uncontrolled high blood pressure, the number one cause of strokes. High blood pressure silently damages blood vessels over time, making them weak and prone to rupture or blockages. Many people don't realize they have hypertension because it often has no symptoms. Regular monitoring, a healthy diet, and medication, if needed, are crucial to keeping it under control. Smoking and alcohol. They damage blood vessels and increase stroke risk. Smoking thickens the blood, narrows arteries, and increases clot formation, making a stroke far more likely. Excessive alcohol consumption raises blood pressure and contributes to irregular heartbeats, further increasing the risk. Cutting back or quitting both habits can significantly reduce stroke chances. Poor diet. Too much sugar, salt, and unhealthy fats can clog arteries. A diet high in processed foods, trans fats, and excessive salt contributes to plaque buildup in arteries, restricting blood flow to the brain. High sugar intake also spikes blood sugar levels, leading to inflammation and damage to blood vessels. Prioritizing fruits, vegetables, lean proteins, and whole grains can dramatically lower stroke risk. Lack of exercise. A sedentary lifestyle weakens the heart and brain. Physical inactivity leads to poor circulation, obesity, and high blood pressure, all of which are major stroke risk factors. Even light exercise, like walking for 30 minutes a day, can improve heart health and blood flow, reducing the chances of a stroke. Ignoring small warning signs. Never assume symptoms will go away. Many people ignore early stroke symptoms, such as sudden dizziness, vision problems, weakness, or numbness on one side of the body. Even mild signs could indicate a mini-stroke, TIA, which is a serious warning of a future major stroke. Seeking medical help immediately can prevent permanent damage and even save your life. Protect yourself from stroke. The life-saving plan. Control blood pressure. Get regular checkups and eat potassium-rich foods. Stay active. Even just 30 minutes of walking daily can prevent strokes. Eat brain-boosting foods. Load up on berries, nuts, fish, and leafy greens. Know your family history. If strokes run in your family, be extra cautious. Manage stress. Chronic stress can increase blood pressure and stroke risk. Every 40 seconds, someone suffers a stroke. Every 4 minutes, someone dies from it. 80% of strokes can be prevented. If you've noticed any of these symptoms in yourself or someone else, don't wait. Call for help immediately. A stroke doesn't give second chances. Help spread awareness. Share this video to save lives. And don't forget to subscribe for more life-saving health tips.